We talked a bit and you showed an image of stage 1 periodontal disease, an image that I'm sure the majority of dog owners and veterinarians have seen, themselves in their pet's lifetime or their patient's lifetime. Has the college or anyone done studies about how often a veterinarian would just say, let's keep an eye on it? We know.
That's you know, uh, they haven't, um, because what would truth really come out, I don't know, you know, but unfortunately, keeping an eye on it has been, I would say, probably since the Romans or before that. It's just a reflex. And I've said it too, I say I want to watch it, but watching it means I'm just not willing to treat it or don't understand to treat it. But I think in this case, it is dangerous. It is very dangerous because of the progression of disease. This is not a stagnant disease. If it were a linear disease, and you knew for a fact it's going to be the same in January as it is in December, then you could have an argument when you want to treat that. But that doesn't work in the biology of the mouth. That doesn't work with plaque and all the inflammatory precursors. And this is something, we are so fixated as a population right now on inflammation, right? And as we should be. We're looking at different things that are helping us to be happier, healthier, longer. And it's either metabolically or internal, all the things that help prevent us from going through a life of pain. So if we look at how the biofilm and how the bacteria and plaque are important in the initiation of the inflammatory cascade, and we can block that, that is huge. But the only way that we can is first remove the source. So we have to take care of inflammation at the source, and that is by mechanically removing plaque and in going underneath the gum line and curetaging the gum line and removing those inflammatory cells. And there are some things at home. There are some fatty acids. I love a fatty acid that has a product called tetradecanol in it. It's called 1-TDC, and it's a fatty acid that does help in periodontal health. It's not a monotherapy. It's not going to do it in by itself, but in types of conditions where I remove the inflammation via professional cleaning, and then I get them on a home care, either on chews or rinses or water additives that are approved by the Veterinary Oral Health Council. That's something else that, Sherry, that is huge, is we are bombarded with things for our pets, and we don't know one from the other. If they say it's guaranteed, who's guaranteeing it? Because the FDA doesn't regulate that well at all. But the Veterinary Oral Health Council is set up so that these companies volunteer their products to be tested for efficacy. That's huge. So you can go on the website, vohc.org, and find those products, those chews, water additives, diets, things of that nature that do help as you as a consumer. So going back to that stage 1, inflammation, I would clean that mouth, talk about home care, enzymatic paste if practical, at least a water additive, and then I want my eyes back on that patient. And I want to look at them in a few months and go, how you doing? And then we're going to talk to them in a frank discussion. It's like the Romans, this, or this. And it could be that they're able to do home care. It may be their life is very complex and they can't. They're doing as best they can, but they're using a water additive and other things. And guess what? In the chews, and they're doing a great job. So the key is I want that inflammation checked, and then I know that I'm going to have to do the procedure again. The owner knows they're going to have to do the procedure again. This is not a once and done. This is not a neutering where all of a sudden the next year the testicles grow back. Ain't going to happen that way. This is a lifetime of care. But if I can eliminate the fear of anesthesia, the understanding that by doing what they're doing, their pet is going to be happier, healthier, live longer potentially, because when they're 14 or 15 years old, when that Cavalier King Charles Spaniel has mitral disease and is going to be very difficult to anesthetize, I'll know that that mouth is clean and I don't have to worry about it. Versus a train wreck that they go, oh dear, we're going to have some problems. And it becomes an anesthetic risk. So that when they're seniors, they've got at least a good chance of having all their teeth left, and they don't have to go through those traumatic type of anesthesias.